Welcome back to TV5 News at 9. Joining us this morning, a real treat, Dr. Hesham Gayar. Thank you so much for being here, Doctor. How are you?
I am fine. It's my pleasure to be here with you.
We are so glad you're here. We are talking, friends, about proton therapy and recurrent cancer. So, Doctor, can you explain what recurrent cancer means?
Recurrent cancer is a common problem in cancer treatment that oncologists or cancer specialists are aware of it, and some patients unfortunately get it. There is cancer recurring or coming back after first attempt to cure. The cancer cells grow back in the region or where it was before. That's called the recurrence. Often when that happens, the treatment is difficult because of previous surgery, previous radiation, chemotherapy. The tissue are treated to tolerance or close to tolerance, and sometimes the treatment cannot be given with a curative intent. It's given for palliation or to buy time, or even the patients sometimes are told, we can't help you anymore. In those cases, we are likely to help with proton therapy, as it's a very special treatment and can be used to cure recurrent cancers much, much better than regular treatments can.
Oh, that's terrific news. That's great to hear. Doctor, are there types of cancers that are more often recurrent than others?
I would say most of the cancers can recur. It depends on the stage, the location, the type of tumor, and the procedures done initially. But almost all the cancers are well known to have possibility of recurrence or coming back, especially when they're coming back and the return is close to critical organs. Then we can help with that. So I can name any of cancer, and there is a risk that cancer could come back. And it's always mentioned to the patient up front. Sometimes it's a small chances when the cancer is early stage, and sometimes it's late, and what can be done is risky, or the risk of recurrence is high. That's why we advise for screening and taking care of your screening, catch the cancer early.
Yeah.
But if it happens to recur, we have a particular treatment. There is proton therapy, and if you wish, I can explain what that is and how it works. It's basically a small subatomic particle, so very, very, very tiny, cannot be seen even with an electronic microscope. Small particles that are set at a certain speed to lay and deposit in the tissue, targeting the cancer very, very precisely. And the positioning of those does not exit the target. Unlike regular radiation, it goes through the body and everything in the way, and past the way is irradiated. Proton therapy just are spots that in three-dimensionally planning can be spotted one by one in the areas desired to be treated. That way we can spare normal tissue, and we can treat where the other treatments stop, and we can proceed and offer cure most of the time or many times to those patients with recurrent cancers. So if you have that problem or know someone that has the cancer coming back, before you get another treatment that may be palliative or limited in outcome, and that usually is well explained by the oncologist. If radiation is being used in the management of your treatment, upfront or for recurrence, find out if proton therapy is a better option for you. And that is what I would advise, because these are tools that were not available before. And now we have the latest technology in proton therapy. Very precise beam that stops at the target, three-dimensionally shaped, accessed from where we think is best, with computer planning and using the MRIs and the PET CTs and the other studies to define the definition and the location. The success rate is higher, the side effects are better.
Well, let's break this down just a little bit, Doctor. I want to know exactly, why is proton therapy, I know viewers want to know, why is that a good treatment option for recurrent cancer?
Thank you, and that's exactly what I was trying to make. So thanks for the question that makes the point more emphasized. When we treat recurrent cancer, previous radiation is given, surgical scarring at the site of treatment, chemotherapy, drugs, first line has been exhausted, and maybe sometimes second line. The options of general treatment, conventional treatments, are limited. And often we treat those patients with limited dose, or we can say, because of damage to normal tissue, we can't give you a curative dose, but we'll shrink the tumor. It's a palliative treatment. It's just something to get by. If you're hearing that, know that the outcome is not that good. Proton therapy, because of its characteristics, it's a focused, precisely positioned treatment that stays at the target. So if you have a beam and you're shooting the beam to the target at a certain speed to lay layers of spots where you want it delivered exactly, and those spots do not exit through. Because proton therapy is a particle therapy that stops in tissue. It doesn't penetrate through like regular conventional radiation. And it deposits most of the energy, 70 to 80%, at the point where it stops. This can be tailored carefully with computer planning to have the radiation deposits where it belongs, in the target, in the cancer, and not to the normal tissue. That allows us to treat to higher doses safely, and it allows us to spare normal tissues around the target being the cancer or the area that we want to treat for the recurrence, and give a safe, effective radiation dose with the patient have no side effects or little side effects during treatment, a better quality of life after treatment. And this has been proven over and over in many parts of the body. Recurrent cancer can be present in the head and neck area. For head and neck cancer, tonsil, lymph node coming back after treatment. These are common problems in the brain, in the base of skull, in the eye, and around sensitive structures. Can happen in the chest, next to the heart. Lymph nodes, lung cancer often comes back, and one of the most common cancers to have recurrences. And that's a common problem. After initial treatment is given, proton can help and can safely be delivered. In the abdomen, colon cancer, rectal cancer can come back. Prostate cancer can come back. Now we can even treat cancer that is metastatic spread. As long as the spread is up to 5 tumors, we call it oligometastatic disease, and can be treated with ablative intent. That is, eradicate each of the areas where the cancer has spread to and obtain better outcome and better quality of life. And this has been proven by randomized trials.
And it sounds like, wow, that is something a lot of people want to find out more about. So doctor, how can patients find out if proton therapy may be the treatment for them, the right treatment option for them?
If you have cancer, or your friend or a family member have cancer, and you hear the word the cancer has come back, or even upfront, if the cancer is there and you're offered radiation treatment as part of the treatment, before you proceed, give us a call or check the website. It's at 855-MY-PROTON is our phone number, and mclaren.org/proton treatment is the website. Find out if this treatment is good for you or not. We will review your case. We will have someone advise you if it's worth it to have teleconference, even without traveling, or yes, you are a candidate, come over and we'll see what we can do for you and help you. So if you have diagnosis of cancer, you're being told radiation is part of the treatment, find out if proton treatment is a better option for you.
Yeah, well, you've definitely given a lot of people hope, and they know that there is help that's out there. Doctor, thank you for bringing us this valuable information today. We appreciate you.
Thank you very much.
Of course, you're so welcome. And you can find out more information in the hot link section at WNEM.com.